This used to be a daily habit for everyone, di ba? Tracking, ilang cases today. For some reason, people have not been checking. You may not have noticed 2,000 cases once again.
There seems to be little alarm or low alarm over the new variants BA.4 and BA.5. And having gone through COVID myself, I've been tracking my symptoms. I feel like I got the latest variants. And it's no joke because you get the full stretch compared to the milder versions. Yung sa Omicron, medyo mild na. Ito, talagang lahat, high fever, etc., etc. And there seems to be studies coming out about the immune evasiveness of BA.4 and 0.5, whether you've had vaccines or whether you've had hybrid immunity from getting COVID. I feel like we need to put the alarms a little bit higher than that. We'll get to know more.
The ironic thing here is both experience and knowledge could be contributing to complacency as well as a sense of alarm. But where's the balance there? Here to talk to us more about the latest COVID-19 situation in the country, Professor Guido David, a fellow from the OCTA Research Group, is joining us via Zoom. Welcome to The Big Story, Professor David.
Hi, good evening, Robbie and Gretchen.
Hi, Professor, let's start with that. As we said, 2,000. We haven't seen this in quite a while. Maybe people even haven't noticed that we're back to 2,000 new cases. And yet, as we've been discussing, there's no sense of urgency. Obviously, this has something to do with people also knowing how to track hospitalization rates and so on. But what else is going on?
You're correct, Robbie. There seems to be no sense of urgency now, and I think the public is wiser now. I don't think they're getting alarmed over cases now. I mean, I think they are aware that the Omicron is milder, especially if people are vaccinated, and there are fewer cases in hospitals. What can we do? Well, we just continue to track and, maybe give advice, especially to those who need it or want it. Yung pinaka-concern naman natin dito, of course, are those with comorbidities and the vulnerable sector, the seniors, who may be at higher risk for severe COVID. As for the general population, I mean, economy is very important right now. The balance is leaning towards the economy and livelihood. So that's why there's no escalation of alert levels. But even if we don't escalate the alert levels, or even if there's no sight of any or a hint of any lockdown in sight, I think we should raise the awareness, at least, that people should still be very careful and that the virus is still here.
I mean, that said, Professor David, this is, I think, clearly a surge. Now, usually before, every time there's that word is trotted out, there is always a qualifier there, a mild surge, whatever. Is there any qualifier? And what would be another word to pair with this so people can have a proper frame of mind in terms of what we're facing here?
Well, I believe it's a surge, Robbie, and maybe it's a surge not like the same level as what we had in January when we had 40,000 cases. And last year, during the Delta surge, we had 25,000 cases. So now we have 2,000. In comparing it, it looks like a much lower number of cases. But we do know that right now we're testing 50% fewer compared to January, and we're also testing 1/3 of what we were testing last year. So the number of tests we conduct each day is far fewer compared to the previous surges. So the actual number of cases is likely to be much higher than 2,000. It could be in the range of maybe 6,000 if you multiply it by 3, or even up to 20,000, accounting for a lot of people who are taking antigen tests or not even getting tested.
Weeks ago, Professor, you mentioned that you expect the peak of the COVID numbers very soon. Is that prediction related to how BA.4 and BA.5 trends have been doing in other countries?
That's exactly right, Gretchen. We were tracking the situation in South Africa, and the COVID wave there lasted for about 2 months, which was about more or less like what we had in January during the first Omicron wave. Now, this has actually lasted, it's actually tracking for over 2 months now. We expect the peak to happen soon, especially in the NCR. And in fact, might have already peaked. So we just need a few days to confirm this. The daily positivity rate in the NCR is already starting to decrease. 3 days in a row, the positivity rate has actually decreased. So that's good news for us. And we expect that other provinces which are also experiencing the wave will soon start to peak as well.
In terms of the booster rollout, how are we comparing to other Southeast Asian countries? And what has been effective in getting people to get boosted?
Well, I'm actually a bit disappointed that our booster numbers are quite rather low. We have about 15 million Filipinos with the booster shot, first booster shot, compared to more than 70 million Filipinos already fully vaccinated. Now, we're probably not, we probably don't have the lowest booster coverage in Southeast Asia. I think Indonesia also has a low booster coverage. But other countries have high booster coverage like Singapore, I think Malaysia, although, of course, their population is relatively lower. So I think we could still give more emphasis on the booster shots and how the vaccines have really helped us in, managing the pandemic. Because last year, when we were at this situation, we would have to lock down and, stop the economy. Now we don't have to lock down. We don't have to stop the economy. We can live with the virus, so to speak, even as cases are rising. We can somehow manage it because hospital cases are fewer. But that's because, in large part, to the vaccines and the booster shots.
Professor David, given everything we were discussing about, whether people still have a proper frame of mind, if they're desensitized to this, they're used to this, or they're more analytical. Given all of that, on the communication side, do you think the alert level system still works, or is there anything to be tweaked with how government engages with the public?
Well, we should have a warning system, at least, so to inform the public whether cases are rising, whether it's at a level that is, concerning or not. And at some level, I think the alert level system still works. But perhaps we need to tweak it now because the alert level system was primarily designed with the previous variants in mind, like the Delta variant, which was a lot more contagious and a lot more deadly. So I think, retweak is in order. And we also have to adjust our metrics because, we can't be too alarmed by, a low level of cases that are rising. Unlike before, we knew that hospitals would be overwhelmed at some point. But now we're confident that hospitals will not be filled up. But at the same time, we still need to give, like I said, bring proper awareness to the public when cases are rising so that they can adjust accordingly. They can adjust their behavior, and seniors and those with comorbidities can reduce their mobility or decide to stay at home so to prevent getting COVID.
One last question, quick question lang, Dr. David. We know you're the mathematician in the group, but maybe this is something that you have discussed as well with Father Nick Austriaco, the biologist, the molecular biologist, and the epidemiologist in the group. Mask mandates, what's the position of OCTA?
Well, I'll be transparent here, Robbie and Gretchen. Actually, we're now part of a bigger group called the Advisory Council of Experts, which is headed by Mr. Joey Concepcion. And this is one of the items that we have discussed because we're also looking forward into possibly exiting the pandemic and how we will deal with the pandemic when it's no longer considered a pandemic, when we treat it like an endemic disease. So, we actually have proposed a framework wherein masks can be relaxed, but this is dependent on the number of cases, if cases are low, and the vaccine and booster coverage. So we need to ramp up vaccine and booster coverage to reach target levels that may allow us to relax the mask mandate. Well, I'll leave it at that because it's still a proposal that we actually have sent to the Office of the President.
Okay, maraming salamat po. That's OCTA Research Fellow Guido David.